Good afternoon, everyone.
Good afternoon, sir.
Okay, thank you. So, today we will discuss about another national health program, that is NIDDCP, that is National Iodine Deficiency Disorder Control Program. Okay, so you might have finished your topic on iodine in the nutrition chapter, and also we will cover the nutrition spotters. There also we can discuss something about this iodine, right? Okay, so before going into the main session, we will do a small pre-test. So take your pen and book. So you can search your materials, books, internet, and you can answer. You can unmute and you can answer after a 10-second timer, right? You can unmute yourself and you can tell after 10-second timer. Okay, we'll go for the pre-test. So first question is, when was National Goiter Control Program launched in India?
(1962).
That's good. One you are responding is 1962. Any other options, students?
(1962).
1952. Okay,
62.
immediately.
1962.
1962.
1962. Okay, many voices, about % we are hearing as 1962. Okay, we will see during the lecture and during the post test. Second question, daily requirement of iodine in adults is 50 microgram, B 100 microgram, C 150 microgram, D 200 microgram.
150 micro.
150 micro.
Excellent. Any other options, students?
150.
Okay, so majority we are opening for 150 microgram, which you might have seen during the iodine topic, right? Okay, we will go with the third question. The twin fortified salt, what it is, what it contains: iodine and fluorine, iodine and calcium, iodine and iron, and D, iodine and chlorine.
Iodine and iron.
Iodine and iron.
Option C.
Excellent. So many of you are opening for option C, that is iodine and iron. Okay, this is a simple question. We will see during the post test which is the correct option. Okay, the fourth question, under the PFA Act, Prevention of Food Adulteration Act, the expected level of iodine in iodized salt at production level and consumer level should not be less than A 90 ppm and 60 ppm respectively, B 60 ppm and 15 ppm, C 30 ppm and 60 ppm, D 30 ppm and 15 ppm.
30 ppm and 15 ppm. Option D.
Any other options? Okay, so we will move to the next question. We will see during the lecture. So recommended daily iodine dose in pregnancy is how much? A 15 microgram, B 100 microgram, C 150 microgram, D 250 microgram.
250 microgram.
250 microgram.
Yes, iodine is a very important.
250 microgram.
We have to give during the pregnancy and also during the lactation. And you should remember the doses during adults and also in the pregnancy. Okay, we will see during the post test. Okay, headquarters of salt organization is located at A Hyderabad, B Jaipur, C Tamil Nadu, D Andhra Pradesh.
Jaipur. B Jaipur.
Any other options, students?
Jaipur.
Okay, this is the new one, that is SALT organization, which is old back, but you might get in during your any competitive exams. You should know about this thing, right? Okay, we'll see during the lecture and also during the post test, which is the correct option for this headquarters of SALT organization. So we move into the seventh question. Double fortified salt provides how much grams of salt? How much iodine and iron per gram of salt? Option A, 60 microgram iodine and 2 milligram iron. B, 40 microgram iodine and 1 milligram iron. C, 1 milligram iodine and 40 microgram iron. D, 2 milligram iodine and 60 microgram iron. So what is the correct answer? So this is nothing but a simple mathematic model. You have to remember the numericals a lot in the nutrition. So as like in the iodine or in the salt. Okay, we will see during the lecture and also during the post-it, which is the correct answer for this question. So we move on to eighth question. On an average, in areas with mild to moderate iodine deficiency, IQ, intelligence quotient of school children is lower by how many points? A, 5 points, B, 13 points, C, 25 points, D, 33 points.
13 points.
Okay, we will see during the lecture and also during the post test. So ninth question, when is Global Iodine Deficiency Disorders Prevention Day observed? A, 31st August, B, 17th September, D, 21st October, D, 14th November.
21st October.
Any other options, students?
21st October.
Okay, so majority opening at 21st October. Okay, we will see whether it is correct or not. So last question, that is 10th. The best indicator for monitoring the impact of IDDCP, Iodine Deficiency Disorder Control Program. A, prevalence of goiter among school children. B, urinary iodine levels. C, neonatal hypothyroidism. And D, iodine level in soil.
Prevalence of goiter among school children.
Okay, any other options, students?
Urinary iodine levels.
Okay, some are opening at A, some are opening at B. Any other options you want to give? Okay, we will see during the lecture and also during the post test. So with this, we complete the pre-test. So we will move into the today's lecture, IDDCP, right? So again, in this topic, we are discussing this topic under this broad subheadings. So we should know something about what is iodine and what are the different iodine deficiency disease or disorder, IDD. What is its spectrum? Then what is the history of this program related to this iodine? Then we will go to the main topic, that is NIDDCP, National Iodine Deficiency Disorder Control Program. So again, we will discuss on different subheadings like overview of this program, what are the different goals and objectives, what are the different indicators, what are the achievements we got through this program, and what is the IEC which they have implemented through this program, right? So we will go with the first subheading, that is iodine. So, okay, what is iodine? Whether it is a macro element or micro element? What it is?
Micro.
Yes, it is a micronutrient. So we'll discuss about what is iodine, what are the different sources of iodine, what is the requirement, how much iodine you should get it daily in your diet to your body. Again, as you said, it is an essential micronutrient which is required essential to the body. And why it is required? It is required. One of the function is for the synthesis of thyroid hormones mainly, that is T3 and T4. So iodine is also essential in minute amounts for normal growth and development and well-being of all the humans. So what are the different sources of iodine, you know?
Seafoods.
Excellent. Any other?
Iodized.
Iodized salt.
Okay. So we are asking about the what are different natural sources. So later,
Cauliflower.
cauliflower. Any other? What you drink daily during your childhood?
Milk.
Milk.
Milk is also a
Dairy
source of
product.
iodine. Dairy products, meat. Okay, so these are the different sources of iodine which you might have learned during your biochemistry. Since till first year you are learning more about this iodine topic. Okay, about 90% of iodine which we are taking comes from the food, and the remaining 10% will come from the water. So again, what is the best source of this iodine is the nothing but seafoods. Simply sea fish. Sea salt is also containing, but sea fish is the main best source of iodine, and also cod liver oil. So others includes what you said like milk, meat, vegetables, cereals. These are all also sources of iodine. So what is the requirement? So you have to remember these two numericals mainly. That is about 150 micrograms daily requirement of iodine is required for adults, and during the pregnancy and lactation. So different international organizations like WHO, UNICEF, they have recommended a standard of 250 micrograms of iodine daily requirement for the pregnancy and lactation. So if they are a child like 0 to 59 months, so they might require a dose of 90 microgram per day. So if they are child like 6 to 12 years, so they might require 120 microgram of iodine, daily iodine. So these two you should remember: adult 150 microgram daily, and pregnancy and lactation 250 microgram daily requirement. Okay, so we move into the why we are discussing why there is a need of this program, right? So there is some deficiency related to this iodine if it is not sufficiently supplied to the body. So we will discuss something about spectrum of iodine deficiency disorder. So again, it can be classified broadly into 4 subcategories according to the age group, starting with the neonates, that is starting with the fetus before birth. So what will happen if there is an iodine deficiency during the pregnancy? Then we'll go with the neonate, second, third, adolescents and children. Then 4th category is adult. Right? So we'll discuss something about what it will affect the fetus, how. So again, the same like abortions, stillbirths may occur during pregnancy. Then congenital anomalies may occur in this fetus. Then increased perinatal mortality, increased infant mortality rate, neurological cretinism will be seen, which includes like mental deficiency, deaf mutism, spastic diplegia, squint. So others include like myxedematous cretinism. So again, they will be like dwarfism or will be like mental deficiency. So other IDD like psychomotor defects also will occur in the fetus when there is a deficiency of iodine. So coming to the neonate. So again, they may occur with the neonatal goiter or neonatal hypothyroidism. So coming to the child and adolescent, so again they may be goiter, enlargement of the thyroid gland, then juvenile hypothyroidism, impaired mental function, or retarded physical development. Retarded physical development. So coming to the adult, so again it will be occurring goiter with added with the complications. Then hypothyroidism we might see, then impaired mental function, right? So again, one more thing you have to remember is in areas in the community with mild to moderate iodine deficiency. So again, there is a decrease of 13 points of IQ on an average on these children. Of the school children, there will be a lower of 13 points of IQ in these children. This thing you have to remember because very important. You might get during your lot of competitive exams. So we will see a small commercial which they have released a long time back to show the importance of this iodine. Just watch the video.
Master Ji, why is Ashish lagging behind studies? He puts in a lot of effort. It seems that Ashish's mental functions are impaired. But why? Iodine plays an important role in the mental development of a child. Deficiency of iodine in early childhood causes loss of 10 to 15 IQ points in children. Iodine? Iodine is a micronutrient. Pledge that you will only use iodized salt in your home from today. Daily consumption of iodized salt is a healthy habit.
Good. This is an excellent IEC material, that is Information Education Communication. Under this broad heading, they have released this video by the Government of India to increase the awareness of intake of salt with iodine, that is iodized salt, right? Okay, what are the different indicators of epidemiological assessment of this iodine deficiency? So again, you can know by calculating the prevalence of goiter or prevalence of cretinism or urinary iodine excretion, or simply measuring the thyroid function of T4 or TSH. Then you can know by knowing the prevalence of neonatal hypothyroidism. So these are the different indicators for epidemiological assessment of iodine deficiency. So okay, we will go into the history. So how this program has evolved. So do you know any other name of this program, NIDDCP? That is the first name. NIDDCP is the second name. It was renamed as NIDDCP.
National Goiter Control Program.
Excellent, very good. So National Goiter Control Program, NGCP. Okay, so we'll go into the history of this program. So how it is started, how it is gone. So okay, this is a beautiful valley, Kangra Valley in Himachal Pradesh. So they have started an experiment, Kangra Valley experiment, due to there is a lot of burden of this goiter in the Western Himalayan belt. Then Government of India, along with the Government of Punjab during that time. So they have started a Kangra Valley experiment in Kangra Valley during the time period of 1956 to 72. So it was started as a 5-year start, 1956 to 61. Then it was extended as like to the 72. In between, a lot of changes will be, they have recommended, government have taken all these recommendations. Okay, so this is a community-based prospective control trial in Kangra Valley, Himachal Pradesh in India. So again, this area of Kangra Valley, study area, was divided into 3 zones, that is A, B, and C. And totally, there is an inclusion of approximately 90,000 population in this study. So again, it is comprising a predominantly rural population in the Himalayan goiter belt. So this is the Himachal Pradesh. This is the Kangra Valley where this Kangra Valley experiment was taken. So again, the study area is divided into 3 zones, Zone A, zone B, and zone C, as you saw in the picture. So zone A people, so they have given potassium iodide salt, Ki, salt containing potassium iodide. Then zone B, they have given plain salt, that is nothing but unfortified salt. So they gave given only plain salt without adding anything. Zone C people have got KiO3 salt, that is potassium iodide salt. So again, they have observed the findings after a period of 5 years. So after these results, so this experiment lead to establishment of what you said, that is National Goiter Control Program. This was started in the year 1962, right? So after the 1956 to 61, 5 years phase, after the result, they have started initiation of this National Goiter Control Program in the year 1962. Then provided iodized salt in the endemic areas through iodine subsidy was the key strategy for the control of goiter under this program. So they have targeted mainly the endemic areas starting with the 1962. So in 1984, Government of India took a policy decision to iodate the entire edible salt in the country by 1992. So by 1992, it should be completely iodized. They have targeted, and this started commencing in a phasic manner from the April 1986. So now comes the 1992 program, that is NIDDCP. So this National Goiter Control Program was changed to NIDDCP. So the complete nation should require the iodine, not only the endemic parts, because of different survey results of this Kangra Valley study and other different ICMR studies and different research studies have advised to give complete nation iodized salt. So we will discuss about National Iodine Disorder Deficiency Control Program. So we will discuss what is this program. So it is realizing the magnitude of the problem. The Government of India launched a 100% centrally assisted National Goiter Control Program in the year 1962. So after 30 years with a lot of research, they have started in the August, they have renamed this NGCP as National Iodine Deficiency Disorders Control Program. So with a view of wide spectrum of iodine deficiency in the country, like there are a lot of disorders like mental and physical retardation, cretinism, stillbirths, abortion, etc. A lot of things have happened. So they have found it not only the goiter, they have found a lot of things due to this iodine deficiency in the nation during that research. So this program is being implemented in all the states and union territory for the entire population of India. So what are the different goals of this program, NIDDCP? So to bring the prevalence of iodine deficiency disorder to below 5% in the country, and also to ensure 100% consumption of adequately iodized salt at the household level. So at least it should be having 15 ppm of iodine. This salt should be at least containing 15 ppm of iodine at household level. So what are the different objectives of this program? Okay, these surveys to assess the magnitude of the iodine deficiency disorders, they have done a lot of surveys. Then supply of iodinated salt in place of common salt. So they have recommended complete replacement of this salt to the iodinated salt. So resurvey after every 5 years. Why? To assess the extent of iodine deficiency disorders and the impact of iodinated salt. So laboratory monitoring of iodinated salt and also the urinary iodine excretion. This is a key marker. So urine iodine is a key marker during the monitoring of this iodinated salt in the human. Then finally health education and also publicity for to increase awareness in the public and also in the community. So why they have chosen salt? Why not any other product? You know, this is affordable and everyone uses it. Simple. So it is one of the essential commodity used by all the socioeconomic groups, irrespective of higher or lower in India. So can reach all groups of community if salt is supplemented with the iodine. So they have selected salt to be iodized so that it can reach every house to house in the country. So what are the different indicators? We will discuss some indicators to monitor the success of this program. So these are nothing but 3 broadly classified: process indicators, impact indicators, and sustainability indicators. So we will start with the process indicators. So again, indicators to monitor, these are nothing but indicators to monitor and evaluate the salt iodinization process. So how? So to know the salt iodine content at the production site, that is manufacturer level. So again, we can also know by the salt iodine content at point of packaging. We can know by this, by the salt iodine content at wholesale and retail levels. Then we can also know this indicator through salt iodine content in the households, right? So these are the different standards of iodized salt. So what is the level of iodine in the salt recommended? So there should be at least 30 ppm at the production level, that is manufacturer site. So at least 15 ppm should be there at the consumer level, that is household level. This thing you have to remember, very, very important. So what is next? Impact indicators. So indicators to assess baseline iodine deficiency disease status and to monitor and evaluate the impact of salt iodization on the target population. So here we are checking urinary iodine levels. Once a salt iodization program has been started, we have started checking the urine iodine levels. So this is the principal impact indicator of all the things, urine iodine levels. So coming to the next one, that is sustainability indicators. So again, we should know, so this program has been sustained to a long term or not. So indicators to assess whether iodine deficiency has been successfully eliminated and whether achievements can be sustained and maintained, we should know. How we should know? So through median urinary iodine levels in the target population, or through availability of adequately iodized salt at the household level. So this we can know whether these achievements are sustained or not. Every household is containing iodized salt means yes, this is a good achievement in the coming decades. So that this is an useful indicator. Again, you should remember this NIDDCP is a multi-pronged strategy. So we cannot rely upon one strategy. So it is a multi-prong. So how? We can see in this picture. So again, so it also depends on the demand of iodized salt. So it also depends on the supply of iodized salt. These are mutually dependent, demand and supply. And again, these are also dependent on the regular, reliable, representative state level scientific data through research. Then it also depends on the data for decision makers. Sustained political commitment is necessary for the successful of this NIDDCP. So finally, all will finally output as promotion of consumption of adequately iodized salt forever in a long-term basis in the decades. So what are the different achievements of this NIDDCP? This is very important. You might get as short notes. So what are the achievements of this National Iodine Deficiency Disorder Control Program? So there is a big list. So you should identify some key points. So first one, the policy regarding production of iodinated salt has been liberalized, permitting production by the private sector. Previously, they are produced only, they are given permission for the public sector entities. So after this program has started, they have given permissions to the private sector also to produce the iodated salt. Again, the next one is the annualized production of iodated salt was raised from 5 lakh metric ton in 1985 to 86 before the start of this program to the 49 lakh metric ton in the year 2005 to 2006. So under the Prevention of Food Adulteration Act 1954, so Government of India issued notification banning the sale of non-iodated salt for direct human consumption in India with effective from the year 2006 May 17. So this is one of the achievement of this program. The Salt Commissioner, in consultation with the Ministry of Railways, so they have arranged for the transportation of iodated salt. This is very important because it should be transported from one place to another place. So there should be an inter-coordination with the different agencies, different government agencies. So from the production centers to the consuming states and the priority category of B, category B, this is given a priority second to that of defense. So this is the importance they are given to this NIDDCP program. So again, they have set some standards for iodated salt that have been laid down under the PFA Act, Prevention of Food Adulteration Act 1954. So what are these standards? At the production level, it should be at least 30 ppm. At consumer level, it should be at least 15 ppm. So again, this has been included in the 20-point program of the Prime Minister. So such importance they are given to this program. So some cash grants are provided to the central government for establishing the iodine deficiency disorder control cells in the states. These are called IDD cells. They have established in the cells. They have provided some benefits to the states. And again, they also provided cash benefits, cash grants by the central government for health education and also the public campaigns to promote consumption of this iodated salt. So the nutrition and IDD cell of the Directorate General of Health Services, in association with the state level IDD cell, is conducting the IDD surveys in all the states and union territories. They have helped all the states in conducting these IDD surveys, which is very important for the monitoring of this program and the progress of consumption of iodated salt in the community. Okay, so a national reference laboratory for the monitoring of this IDD has been set up at the Biochemistry and Biotechnology Division of the National Institute of Communicable Disease, New Delhi. This is Delhi, NICD Delhi. Again, they have set up 4 regional IDD monitoring laboratories on the different regions of India for imparting training to the medical and paramedical personnel. They have set up, and also to check the different levels of iodine in the urine, and also to check the thyroid hormone levels. They have set up these 4 regional laboratories. They have located it in the south. It is located at ICMR, National Institute of Nutrition, Hyderabad Center. In the east and northeast areas, they have set up in the All India Institute of Hygiene and Public Health, Calcutta. In the west, they have set up in the All India Institute of Medical Sciences, New Delhi. In the north, they have set up in the National Institute of Communicable Disease in the Delhi. These are the 4 regional IDD monitoring laboratories. Okay, for review of this technical aspects of this program, a program implementation committee under the chairmanship of health services also has been constituted. So one more achievement is, it is a multidisciplinary participation or intersectoral coordination along with the medical effort. To ensure this is a central steering committee has been set up under the chairmanship of the Secretary of Health and Family Welfare. Okay, this finished the achievements of this program. So last one is the IEC. So a lot of IEC, information, education, communication, has been done to popularize this program. So extensive IEC activities have been carried out to create awareness about the regular consumption of iodated salt in prevention and control of iodine deficiency disorders through various ways. So they have used telemedia or video media like Doordarshan, then All India Radio, Directorate of Field Publicity Division or Song and Drama Division, Directorate of Advertising and Visual Publicity. So these all has created a lot of pamphlets, or they have dispensed all of the awareness program related to this benefits of iodated salt. So what it is in Andhra Pradesh during this NIDDCP, what are the different endemic districts and what are the indicators, how they have monitored the progress in Andhra Pradesh state, which we are living. Okay, so as informed from previous surveys, so like NIDDCP 1992, then it is implemented in 6 districts during the 1992. They have started in 6 districts of Andhra Pradesh, which are endemic to iodine deficiency disorders. So what are these 6 endemic districts in Andhra Pradesh? These are Srikakulam, Visakhapatnam, East Godavari, West Godavari, Krishna district and Nellore district. So these are the different 6 districts they have started of this program in Andhra Pradesh state. So what are the different indicators? Key performance indicators. We should know the indicators, whether they are performing correctly or not. How So by knowing the number of districts covered in a phased manner in survey and resurvey of this iodine deficiency disorders, including goiter examination or salt testing and urine testing. So we can also know through number of staff trained under this program. So this is also one of the key performance indicator. So we can also know, so how many number of IEC camps conducted through this program in our state, in Andhra Pradesh. So conducted to improve the awareness among the public. So this is also one of the key performance indicator. So finally, we want to discuss something not a topic of this concern, but this is also one of the important one, that is twin fortified salt, also called as double fortified salt. Also it is called as 2-in-1 salt because it is containing 2 essential minerals, micronutrients. So it was developed by the ICMR, National Institute of Nutrition, located at the Hyderabad. So what it contains? It contains salt, potassium iodate, ferrous sulfate, and sodium hexametaphosphate. So it contains 2 minerals, you should remember, that is iodine and iron. So how much it will be there in this twin salt? So it contains 40 microgram of iodine and 1 milligram of iron per gram of salt. So obviously iodine is very trace element. So it is obviously less than the other elements like iron. So 40 microgram of iodine and 1 milligram of iron will be present in this 2-in-1 salt or twin fortified salt or double fortified salt. So again, any national program, so or any other disease, you should remember what are different any programs, any health important days related to this. Yes, there is an national importance day, that is Global Iodine Deficiency Disorders Prevention Day, which we are observing on every year 21st October. This year 21st October is observed as Global Iodine Deficiency Disorder Prevention Day. Again, iodine salt is the best means to prevent abortion, stillbirth, birth defects, incomplete fetal brain development or damage, retarded mental and physical growth. They also prevent goiter, that is nothing but swelling in the neck, or they will prevent low IQ points, or they will also decrease poor learning abilities. That this is the IEC material they have released during the year 2015. So with this, we have completed what we have discussed something about what is iodine, what are the different spectrum of iodine deficiency disorder. Then what is the history? What is the Kangra Valley, where it is and how the survey was done. Then what is this program NIDDCP, its overview, different goals and objectives, different indicators, a lot of achievements, along with the IEC materials, how they have used to the spread of the awareness of this disease. Okay, we will see a small brief video, the completely gist of this video. So you will get a lot of bits from this video, which is given by the SALT organization. We can know the SALT organization, the development of salt, how they achieved this iodinated salt. What is their role? What is their role? We will observe this video.
Salt is a symbol of social harmony and sanctity. The father of the nation, Mahatma Gandhi, chose salt as a symbol to fight against British imperialism as a direct action campaign against the salt tax. India recognized iodine deficiency as a national public health concern right after the independence and began supplying iodized salt to its endemic population as early as the 1960s. A study conducted in 1956 in the Kangra Valley, Himachal Pradesh in North India, established iodine deficiency as a major cause of endemic goiter and demonstrated a significant decline in goiter prevalence in the areas receiving iodized salt. This led the Government of India to launch the National Goiter Control Program, also called NGCP, in 1962 in an attempt to provide iodized salt to goiter endemic districts. At the start of the NGCP, only the public sector was allowed to produce iodized salt. Thus, the government set up 12 salt iodization plants with a total annual installed capacity of close to 0.39 million metric tons and subsidized the entire cost of iodization. A turning point came in 1983 when the Prime Minister accepted the importance of IDD elimination and the eradication of goiter was included as point 8 in the Prime Minister's 20-point National Development Program. The Central Council of Health, the highest health policy making body in India, also made a recommendation in 1983 that as all states were IDD prone, iodized salt should be made available to the entire population. Consequently, in 1983, the government made a historic policy decision to strive for universal salt iodization, also called USI, permitting the production of iodized salt by the private sector. In 1986, the USI policy was announced and the smiling sun logo, a certification of iodized salt, was developed. In 1992, the NGCP was renamed the National Iodine Deficiency Disorders Control Program, called as NIDDCP, reflecting the government's commitment to eliminating the whole spectrum of IDD. Universal iodization of edible salt was the intervention strategy recommended to prevent and control IDD. The objectives of the NIDDCP were expanded to include 5 main initiatives. The Salt Commissioners Organization under the Ministry of Commerce and Industry is entrusted with the task of controlling all aspects of the salt industry. The Salt Commissioner heads the Salt Department with its headquarters at Jaipur. The department has salt offices spread across all salt production centers in the country. Salt is produced in India, primarily in the coastal states and in Rajasthan. India generates close to 24 million metric tons of salt, produced by nearly 13,000 primary salt producers that has a complex delivery network. Historically, the Salt Department of India regulates the industry and monitors production, distribution, quality, and iodine content of salt through a network of 32 static and mobile laboratories. There is a separate IDD control division under the charge of a Deputy Salt Commissioner, as the Salt Organization has been identified as the nodal agency for implementing the NIDDCP. The department provides technical inputs for setting up salt iodization plants and refineries, inspects and ensures that the plants are installed as per the approved design. Small-scale manufacturers are also assisted in improving the quality of salt production, encouraged by the government and responding to the emerging markets. Today, there are close to 900 iodized salt producers, producing about 6 million metric tons of iodized salt. India continues to hold third position in the production of salt after China and the USA. India is the second largest producer of iodized salt, next to China. The continued efforts in implementing the policy initiatives by the NIDDCP and the cooperation of the salt industry under the leadership of the Salt Department have led to substantial progress in salt iodization status in India. In the past 2 decades, the national production of iodized salt has seen an 8-fold increase, 0.7 million metric tons in 1985-86 to the current 6.2 million metric tons. The Government of India reiterates the need to eliminate IDD and recommends USI as the best means to achieve this goal.
Okay, we are very thankful to UNICEF. So in collaboration with SALT organization, they have developed this beautiful video. So you might have learned something about this iodine deficiency disorder control program. Okay, so we are at the end of the session, so we will go for the post test, right? Okay, we will start answering the questions. You can unmute and you can tell. So we can quickly finish this post test. So first question, when was National Goiter Control Program launched in India?
1962.
Sir. 1960.
Sir.
Excellent, excellent, great responses. So as you said, the correct answer is 1962. This was the year NGCP was launched. So second one, daily requirement of iodine in adults is how much?
100 MC, 150 mcg.
50 microgram.
Excellent, very good. So a lot of responses might all of you are correct. That is 150 microgram is the correct answer. The daily requirement of iodine in adults. So what is twin fortified salt? What are the elements? it contains?
Iodine plus iron, option C.
Iron.
That's very good. That is, it contains iodine and iron, two elements. Twin fortified salt or two-in-one salt. So under this PFA Act, so what is the expected level of iodized salt at production level and consumer level?
30 ppm
PM and 15 ppm.
D, sir.
Option D.
Excellent, great responses. That is option D is the correct answer. So at production level, it should be 30 ppm. At consumption level at household, it should be at least 15 ppm. This you should remember. You should not forget. Then what is the recommended of daily dose in pregnancy?
250 mcg. Option D, sir.
Good. That is 250 microgram is the correct option, which we want to give in the pregnancy. So where the headquarters of SALT organization located?
Jaipur.
Excellent. That is Jaipur. You might have
Jaipur.
watched in the video. Yes, very good. That is Jaipur in Rajasthan. This SALT organization headquarters is located. So double fortified salt, which we have seen in the previous question, iron and iodine. So how much they will contain?
40 mcg iodine.
40 mcg iodine and 1 mg iron.
Yes, yes, yes. Very good. The correct option is B, 40 microgram of iodine and 1 milligram iron. So next one. So on an average, in areas with mild to moderate iodine deficiency, so intelligent quotient of children is
13
low.
points.
13 points.
Yes, so you might have seen in the commercial also. It is by average of 10 to 15 points. So the correct option you can pick best is 13 points in this question. Very good. Then ninth one. So when is Global Iodine Deficiency Disorder Prevention
21st
Day?
October.
21st September.
Yes. You might have
Option
seen-
C, sir.
Yes, good, very good. You might have seen in this IC material, that is, you have observed 21st October is every year observed as Global Iodine Deficiency Disorder Prevention Day. So what is 17th September? I have asked in the previous class. You should tell by this time. What is 17th September?
World Patient Safety Day.
Very good, excellent. So that is we celebrating as World Patient Safety Day. This is very important in this pandemic. It highlights, it is very important. What is 14th November?
Diabetes Day.
Very good. That is World Diabetes Day is observed in the 14th November with a blue circle. What is 31st August? Yes, correct option only. That is today. Today is 31st August. It has no such importance related to this health day. 31st August is today. Okay. So last question, the best indicator for monitoring the impact of iodine deficient disorder program is?
Urinary iodine.
Urinary iodine levels, option B.
Yes, excellent. Option B is the correct option. That is urinary iodine levels. Okay, this finish today's lecture of National Iodine Deficiency Disorder Program. Thank you all and stay safe.
Thank you, sir.
Thank you.